Hello, everyone. My name is Phyllis Dako-Gyeke, and I'm making this presentation on behalf of my team from the University of Ghana School of Public Health, from the National Malaria Control Program, Ghana, and from the Ghana Health Service. We work on a project that is titled Improving the Effectiveness of Mass Long-Lasting Insecticide-Treated Net Distribution Campaigns through Community-Based Health Planning and Services Program in Ghana. For short, we refer to this as the MyCamp project. For this presentation, we'll be sharing our background, study objectives, methods, limitations, our results, and the implications for policy, practice, and future research with you. The World Health Organization has identified a long-lasting insecticide-treated net as an effective approach for malaria prevention. And this has been adopted in many countries, including Ghana. In Ghana, the mass LLIN distribution campaign seeks to protect at least 80% of the population that is at risk with effective malaria prevention interventions through household registration and distribution. And this is done within the WHO's Universal Health Coverage Policy. In spite of progress that has been made over the years to increase ownership, utilization remains a problem, especially amongst pregnant women and children under 5 years. Though these campaigns expose high proportions of the Ghanaian community to LLIN interventions, we hardly are able to achieve the desired health-related behavior, which in this case is LLIN use. For this study, these are the objectives that we set out to answer. The overall purpose was to improve effectiveness by transitioning the mass, long-lasting insecticide-treated net distribution campaigns within the community-based health planning and services program in Ghana. And the overall aim was to reduce the gap between access and use. The study was conducted in 6 communities across 2 regions, that is the Eastern and Volta regions, both located in the southern part of Ghana, as you can see on the map that has been displayed on the slide. These were communities within districts where the 2021 point mass distribution campaigns were held. Again, these communities were selected because they had the highest prevalence of malaria, as was reported in the district health information management systems. Specifically, we were looking at Ho West, Ho, Agotime-Ziope in the Volta region, and for the Eastern region, Brim South, Achiase, and also Ebuakwa North. We employed a concurrent triangulation mixed methods approach, and these were done within the implementation research framework. A desk review was conducted that looked at relevant, published, and gray literature. A baseline and endline survey was conducted within these communities. The survey used the RedCap software to collect data using the Android tablets, and the qualitative component comprised of key informant interviews and focus group discussions that were organized across these regions amongst caregivers of children under 5, household heads, and also community health officers. The findings from the desk review, the focus group discussions, and also the key informant interviews, as well as our baseline survey, were synthesized and grouped to guide the participatory workshops that were organized. And for the data analysis for our quantitative data, we used the SPSS software, and the NVivo software was used to manage the qualitative data. We obtained ethics approval from the Ghana Health Services Ethics Review Committee. These are some images that show the community health advocacy team, that is our intervention that was co-created, doing some outreach activities within households, amongst women with children under 5, and also school children. So what did we find out? The desk review revealed that though majority of households receive LLINs, LLINs would not be used if social and behavioral change communication activities are not implemented alongside. Also, community members are engaged to support the campaign. However, local structures are not fully optimized that can help address negative perceptions and misunderstandings that surround the LLIN campaign as well as LLIN use within these communities. Identified enablers such as community receptiveness and also health worker presence within these communities can be leveraged. However, barriers need to be addressed within these campaigns and within these communities. The co-created intervention, which we call the CHATS, that is the Community Health Advocacy Team, includes actors within the community, and their roles they include provision of awareness, LLIN use within these communities, and also malaria prevention information largely within these communities. After a successful implementation of the intervention, majority of the community members perceive CHAT as acceptable, appropriate, and feasible. 4 promising practices: the design and development of a manual that can guide the use and maintenance of LLINs is key. Leveraging CHPS within these communities and transitioning it into the community health committees is key. What are some of the lessons that were learned? Continuously engaging community members to properly educate, promote, and monitor the use of nets while deterring misuse is key. Maximizing the use of community information centers for the mass LLIN distribution campaigns are key. And also when community stakeholders are systematically constituted and also integrated into the community health management team, it is key to ensuring use within these communities. And for implications for policy, we need to integrate the CHATs into the CHPS, reconsider the members of the CHATs, and also determine how to mobilize funds that can be used to sustain the CHAT activities, determine the effectiveness, cost effectiveness of CHAT across Ghana. By way of summary, we would want to say that the NMCP rolls out the long-lasting insecticide-treated net campaign. However, we suggest that it is embedded into the primary healthcare structures. The CHATs, which is the Community Health Advocacy Team, is a way of embedding it, and the LLIN distribution campaign can be transitioned through the CHATs. Would want to say a big thank you for spending time with us and listening to our results.